My name is Elizabeth Brown, and I am the President Pro Tempore of Columbus City Council. I am here to testify against Senate Bill 23 as a policymaker, a mother, and a person who cares deeply about family and child welfare. For the last several years, the City of Columbus has engaged in community-wide efforts to improve the health and well-being of women and babies in our city. Via our anti-infant mortality initiative, Celebrate One, we are taking on the most significant factors that contribute to Columbus's infant mortality rate by reducing premature births, eliminating sleep-related deaths, and connecting the disconnected to resources. We do this through a focus on expanding access to an enrollment in evidence-based home visiting, increased neighborhood-based safe sleep ambassador training, and encouraging early access to quality prenatal care. Thanks in part to this important work, in 2018, more Franklin County babies lived to celebrate their first birthdays, and the infant mortality rate continues to drop incrementally across all populations. We have seen a 23% decrease in the infant mortality rate since 2011, from 9.6 to 7.5 per 1,000 live births. Despite this progress, we still confront an overall infant mortality rate that is higher than the national rate in the United States, as well as persistent and unacceptable racial disparities that we must continue to address. The fact is, African American mothers still experience an infant mortality rate that is 2.5 times higher than white mothers in Franklin County. Throughout this work right here in my city, and in Ohio's own statewide efforts, and through consensus by experts around the country, it is clear that the largest contributing factor to infant deaths is maternal health. The bottom line is that babies are more likely to live to their first birthdays if their mothers have a lifetime of good health care and health. Therefore, we are doing more each year to increase women's health and combat infant mortality. After our progress thus far, we cannot afford to turn backward. And that is part of what concerns me about Senate Bill 23. This bill would essentially eliminate all access to abortion in Ohio. This would work directly against our broader goals of improving women's and infants' health, because abortion access is an important component of women's comprehensive health care. Research in states across the country has shown unequivocally that the more abortion restrictions a state has, the worse health outcomes that state has for women and children. Specifically, a study conducted by the Center for Reproductive Rights found that states with the most abortion restrictions had an increased likelihood for poor outcomes for women obtaining cervical cancer screenings, more chlamydia infections, more new HIV diagnoses, a higher incidence of low birth weights, more maternal deaths, higher incidence of preterm birth, and more unintended pregnancies. Additionally, they found higher infant, child, and teen mortality rates. Instead of passing Senate Bill 23, let's invest together as a state in doing more for the health of women and children. Let's invest in reducing unwanted pregnancies and promoting the success of all families. That starts with comprehensive sex education, medically accurate sex education in our schools, and increased access to contraceptive services. It also means quality, affordable childcare, paid family leave, and other measures to support working families. I oppose this bill, and I urge a no vote in this committee.